Hello. Today's edition of Bob's Coffee Chat is Medicare Unmasked, presented by Laurna Bulahan with Colleen Callahan Insurance Services. Laurna is a Medicare certified insurance agent who has several years of experience working with the senior population. She has a passion to educate and help others. Laurna believes that working with a Medicare agent can be extremely beneficial to help those make sense of the Medicare process, and gives them the information they need to choose the right Medicare coverage for their individual insurance needs. So Laurna, what are the A, B, C's, and D's of turning 65, especially when it comes to Medicare?
Thank you, Bob. I'm going to go ahead and screen share my presentation. Hopefully everyone can everyone see that?
Not yet.
No, not yet. Oh, there we go. Can everyone see that now?
Yes.
Perfect. So hello, everyone. My name is Laurna Bulahan. I am a Medicare sales specialist at Colleen Callahan Insurance Services. Our office is located in Pleasant Hill, but we could do all meetings via Zoom or conference call. Location is not an issue. I've been with the agency for 3 years now. I started as Colleen Callahan's assistant, so helping prepping for presentations and meetings and doing post applications and follow-ups. Since then, Colleen has retired from the agency and sold her business to Heffernan Insurance Brokers. So when Colleen retired, she asked me to get licensed, and I got licensed in January of 2020 and have taken over the Medicare side of the business since then. In my spare time, you can find me in the kitchen cooking delicious meals for my family and friends. I'm doing a Peloton workout class, watching some sports games, Go Niners and Giants, or playing with my 2-year-old rescue dog, Olive, from Taiwan, and my new cat, Mac. Thank you for having me. So the Medicare can be extremely confusing and overwhelming for most. There are a handful of rules and options that one has to consider when they turn 65. Not to mention when you're nearing the age of 65, there's so much information out there for you, and all the insurance companies are sending you, hey, come enroll in our plans and all this information. So majority of people who approach me about Medicare feel like this exact picture right here, a deer in the headlights. So they can also feel like they're lost in a maze, not knowing which direction to take. That is where a help from a Medicare broker like myself can be helpful. We help clients navigate through their options and find plans that fit their specific needs. So a little bit about the history of Medicare. Medicare was enacted as Title 18 of the Social Security Act to provide health insurance to people age 65 and older, regardless of income or medical history. In 1972, Medicare added coverage for people with disabilities, and in 97, based on the Balanced Budget Act of 97, created Medicare Part C, which is now called Medicare Advantage. So who was the first beneficiary of Medicare? The answer is former President Harry Truman and his wife, former Lady Bess Truman, became the first recipients of the program. So in this picture, you see former President Johnson enrolling Truman as the first Medicare beneficiary. So right now, we are at a time where people are rapidly turning 65 every day. 10,000 people turn 65 every day, and by 2030, 80 million people will be on Medicare. So for those of you who are turning 65 this year, you are in great company. So Joe Montana turned 65 back in June. Tom Hanks, Randy Jackson, Gina Davis, all familiar people. Plato was also released in 1956. So Plato turned 65 this year, as well as Elvis Presley's first hit, Heartbreak Hotel turned 65 this year. So what will we discuss in this presentation? First, we will talk about how group and employer benefits affect your Medicare eligibility and coordination of benefits. If Medicare is the route you want to take, we will discuss what are your coverage options, when can you enroll, how do you enroll, and we will also touch on dental and travel insurance, and then end the presentation with questions. So if you're turning 65 and are currently enrolled in your employer plan, you do not need to leave your employer plan when you first turn 65 unless you choose to. Employer size is a big key. So if your employer size is less than 20 employees, then your Medicare is primary and you should enroll when you're first eligible. If your employer size is larger than 20 employees, then your employer plan is primary and you can delay Medicare without facing a penalty. So if you decide to stay on your group plan after you've turned 65, when you leave your employer coverage, you have an 8-month special enrollment period to enroll in Medicare, where you typically will not, you will use your special enrollment period. So from there, you have 6 months from enrollment in Medicare to apply for a Medicare supplement plan, but only 2 months to apply for a prescription drug plan or a Medicare Advantage plan from the time employer coverage ends or Part B effective date starts, whichever happens first. So if you work past the age of 65, as a reminder, if you choose to work and your employer size is larger than 20 employees, keep records of your health insurance coverage. So a letter called a letter or certificate of credible coverage will be needed when you're ready to apply for Medicare to avoid any late penalties. So this is an example of what the letter of credible coverage looks like. The certificate of credible coverage is a document that provides information whether an individual current prescription drug benefits is credible coverage, meaning that the coverage is up to Medicare standards. So you can ask your employer's HR director for more information. So here are additional questions to ask. How big is my company? Knowing this will determine if Medicare or your group plan is primary and if you should enroll in Medicare when first eligible, or to keep records of your letters of credible coverage. Do you have younger dependents? Do you have a spouse who's a couple of years younger than you, not ready quite for Medicare? Do you have children who are under the age of 26? What are their options? So typically we'll look at individual plans for them or COBRA. Are you currently contributing to an HSA plan? When you move to Medicare, you can keep what already is in that bucket of money, but you cannot add to it. Can you keep some benefits? So if you continue working past the age of 65, you can keep your dental and vision employer plans if you choose. Any questions? You can unmute yourself.
Actually, I had one, Lorna. You
Sure.
said, so my company has more than 20 employees. So when I'm ready and I want to keep my employer plan, I do nothing with Social Security?
You do nothing with Social Security, but I would recommend talking to your HR director just to see if your current prescription drug coverage is credible, considered credible up to Medicare standards. So you really are asking for that letter of credible coverage. They'll know what you're talking about, so they'll be able to present that to you. So every year past the age of 65 that you choose to work, you have to get a copy of that and save it for your record. So when it is time to enroll in Medicare, Medicare will ask for those letters.
And when
so
I
you
choose,
can avoid a late penalty.
And when I choose to do that, I have 7 months or 2 months to apply for Medicare. That part I didn't catch.
So you have 8 months. You have 8 months from the end of coverage to enroll in Part B of Medicare, and then from there you'll have to enroll in Part B and then a supplement. but you only have 2 months from the end of employer coverage to enroll in a drug plan or a Medicare Advantage plan.
Okay, and there's a question from the floor. What about, how does this all apply to self-employed people?
Yeah.
Self-employed people, what I would recommend enrolling in Medicare when first eligible.
Yeah, straight to Medicare.
Mm-hmm. All right.
Okay, so that's all the questions at the moment.
So who is eligible for Medicare? So you must be a U.S. citizen or legal resident for at least 5 consecutive years and one of the following: age 65 or older, younger than 65 with a qualifying disability, or any age with a diagnosis of end-stage renal disease or ALS. So next, we're going to discuss the Medicare coverage options. The parts of Medicare come in letters: Part A, Part B, Part C, Part D, and the Medicare supplement plans, often referred to as Medigap plans. So what are the different parts of Medicare? When you first turn 65, you are eligible for Part A and Part B of Medicare. Part A is typically free if you've been paying into Medicare taxes for 10 years. So when you get your pay stub from an employer, there's a line item for Medicare. If you've been paying into Medicare taxes for 10 years, Part A is free. Part B is associated with a premium that we will discuss in a couple of minutes. So once enrolled in both Parts A and B, you have 2 options. Option 1 is to enroll in a Medicare supplement plan partnered with a prescription drug plan. Or option 2 is Part C or a Medicare Advantage plan. So this graph just shows the same information as the last slide, but in a different context. So on the left side of this chart, you'll see original Medicare Part A, Part B with your prescription drug coverage, and then the Medicare supplement insurance. On the right side of this graph is Part C, so your Medicare Advantage plan. Part C combines Part A and Part B and usually Part D. So some plans don't have a drug benefit, that's where you'll enroll in a standalone drug plan. So when you turn 65, you enroll in Original Medicare, which includes Part A and Part B. Part A covers inpatient hospital care, inpatient mental health care, skilled nursing services, hospice care, some blood transfusions, and you can't be turned down because of pre-existing medical conditions or medical history. So Part B are your outpatient hospital services, your physician services, outpatient mental health, laboratory services, any durable equipment such as wheelchairs or canes or CPAP machines, that's covered under Part B. Some preventative care, and then you also can't be turned down because of pre-existing conditions. So cost for Part B, there's no out-of-pocket maximum, but for co-insurance, you pay 20% of Medicare approved costs. Part B also has a monthly premium determined by your income, and you pay this directly to Social Security, and you may have higher premiums if you join after your initial enrollment period. So Part B premiums and IRMA. So IRMA is income-related monthly adjustment amounts. So Part B is associated with a premium and it's determined by your earnings, and it's a 2-year look back. So if you enroll in Medicare in 2021, Social Security will look at your 2019 tax return and so forth. So the standard Part B premium amount in 2021 is $148.50. Most people pay the standard Part B premium amount, and if your modified adjusted gross income as reported on your IRS tax return from 2 years ago is above a certain amount, you'll pay the standard premium amount and an income-related monthly adjustment amount. So this is just showing a table and to give people an idea of where they fall regarding the Part B premiums. So what's not covered by Part A and Part B? So Medicare Part A and Part B deductibles, coinsurance and premiums, Medicare Part B excess charges, which is if you see a provider that does not accept Medicare, they can bill you over a certain amount. Prescription drug coverage is not covered under original Medicare, and additional benefits such as hearing, vision, and dental and long-term care. So Part C of Medicare is your Medicare Advantage plan. So Medicare Part C combines Part A and Part B, and in many cases includes prescription drug coverage. So these plans are offered by private insurance companies. In many cases, you'll need to use healthcare providers who participate in the plan's network and service area for the lowest cost. With these type of plans, you will need referrals from your primary care physician to see specialists, and these plans set a limit on what you'll have to pay out of pocket each year for covered services. So this is just showing the type of Medicare Advantage plans that are available. Any questions? Okay.
How about
So next we'll talk about,
how about vision and dental? Are you talking about that one, or it's not part of Medicare?
So vision and dental is not, you cannot get it through original Medicare. It's not included. But some plans out there have dental and vision benefits built into the plan, into their plan.
So we have a question in the
So
chat.
if you,
Oh, go ahead.
so if you decide, if you're working past the age of 65, but your employer size is less than 20 employees, so you have to move to Medicare because Medicare is primary, you can stay on your group's dental and vision plan. They can just take you off their medical because you're moving to Medicare.
And Laura,
Original Medicare does not include vision or dental, so we would recommend there's individual plans out there, and our office also does that.
and we have a question in the chat. She's enrolled in Part D with Script Aetna and would love to know if there's a new enrollment coming up and if there's a better plan. So
the timing of this presentation is great because open enrollment happens every year from October 15th through December 7th. It allows you to review your options and look at 2022 plans. So that is coming up. So there is an open enrollment for drug plans that starts next month.
And if your company is under 20 employees, then how does your company insurance work with Medicare and paying expenses?
So you could stay on the group plan if your employer size is smaller than 20 employees, but you'll be faced with a Part D penalty because you didn't enroll in Medicare when first eligible. So if you say you enroll in Medicare and you are on your group plan, there's no coordination of benefits. It's either one or the other.
I have a question. It kind of pertains to me. So
Sure.
let's say, because we may retire in New Mexico, and right now I have Kaiser in California, and let's say I enroll in their plan. It's Part C for Kaiser, correct? All right. So if I decide to move to New Mexico, can I switch to Part A and Part B anytime in my golden years?
No. So there's certain criteria of how or when you can switch if you want to.
Oh, okay. Good to know.
Yeah. For you, say you enroll into Medicare here in California, you would have to re-enroll if you move to New Mexico.
So you just simply start the whole process, and it's possible but do I have to go with an HMO if I'm currently with an HMO, or can I go back to A and B?
You technically can go back to A and B if the HMO plan that you are currently enrolled in is not offered in the area that you're moving to.
Yeah, that's
so there's those little rules and compliance rules that you have to follow. So moving does qualify you to go back to original Medicare, but there's also if you can enroll in this if this happens kind of thing.
Got it.
So,
Okay, that's all the questions we have up to now.
Awesome. So next we'll be talking about the prescription drug plans. This is part D of Medicare. So this is the part of the presentation I always like to tell people that sometimes there's a lot of information. It's a federally run plan. So the government sets how the prescription drug plans work. So just bear with me. And if you have any questions, please let me know. So this cartoon depicts the complexity of the Part D plans. These plans, like I said, are designed differently than how we currently get our prescription drug benefits and what we're used to. So Part D helps with the cost of prescription drugs, may lower your costs and protect against higher costs. They're only offered through private insurance companies, and you must continue to pay your Part B premium. So Part D is a staged system. There are 4 stages to the Part D drug plan, and they're as follows. The annual deductible stage, in 2021, the deductible is $445. The initial coverage stage, the coverage gap or the donut hole, and the catastrophic coverage stage. So these drug plans, they're tailored to your each individual medication needs. So based on the type of medications that you take, you'll move through the stages. So you will start in the yearly deductible phase. So $445, once you satisfy that, you'll move into the initial coverage stage. The initial coverage stage is a cost share between you and the insurance carrier. So 25% by you, 75% by the carrier. Once you satisfy, once you spend a total of $4,130 in this stage, you'll move into what's called the donut hole. So the donut hole is where it's a cost share, but you're paying for a majority of your cost of medications versus the insurance carrier. So there is a cap in this stage of $6,550. Once you satisfy that, you'll move into what's called the catastrophic coverage stage. So in this stage, you're only paying for 5% of your medications for the rest of the year. So you may also be subject to a Part D IRMA premium if your earnings were above a certain amount. So again, it's a 2-year look back. So in 2021, they will look at your 2019 tax return. I like to consider it like a high earner tax for your drug plan. You will pay this in addition to your plan premium. So GoodRx is a great resource if you have high cost medications. It's a website where you can go on, type in your medication, and a list of coupons will populate in your area for pharmacies where you can get your medications at a discounted rate. You don't have to use your insurance for this, and it does not count towards your deductible. So you don't need insurance, but it's a great resource. I've had clients come to me. I'm finding that inhalers are really high cost, expensive medications. I had a client come to me and say her doctor prescribed her a $400 inhaler, and she got it on GoodRx for $200. So it does work. You might see more commercials for it now that the annual open enrollment period is coming up. Any questions?
Actually, there was a question in the chat about clarifying what the whole donut hole is about. So let me see if I grasped it. The first $45 is deductible, then you're covered till $4,130, then anywhere between $4,130 to $6,550 you have to pay, and when you pass that up, you get covered again by Medicare from catastrophic coverage. Did I get that right?
Yeah. So based on your list of medications, you'll move through the stages, and depending on how expensive your medications are, you'll move through the stages quicker.
So there's
the drug plans they reset every January 1st of every year. So that's why we meet in the fall to discuss your options.
So
unfortunately, once you enroll in a drug plan, you're enrolled for the year. So say you have medications added, your drug plan doesn't cover that. So then you would want to switch in the fall.
So if you get in the donut hole, and let's say your annual prescription costs are $5,130, $4,130 gets covered by Medicare, and then you have to pay the rest of the $1,000 difference?
It's a cost share. So I don't know the exact percentage that you would pay in the donut hole, but I just know that you are paying more versus the insurance company for your cost of medication.
So so the thing is like, that's my experience is that, okay, for one, I went to the drug plan in Medicare that didn't cover nearly as well as covered California, but I was forced to go to Medicare because of my age. And then, and then all of a sudden it's like everything doubled because I got in the donut hole. It's kind of like, what does that mean? It's like you're being pulled down to the bottom.
That just means, yeah, that just means that your medications are expensive and they're high cost, or the tier. So the drug plans categorize their medications versus
by tiers.
1 to 5.
I know that, and I have 1 and 4 and 1 and 5, and the 5 one is just astronomical. And so I'm actually looking into getting it for Canada or something because.
Yeah, I always like to share like our neighbors to the north might be helpful.
Yeah, and if you have, I don't even know how to even contact anybody in Canada to get, because I know it won't be free, but it'll most certainly probably be far less than what I'm paying here.
Far less. I've had clients who reached out to Canadian pharmacies to get their high cost medications.
Do you have links to those pharmacies?
I do not.
Okay. This just seems so strange though, that donut hole thing. It's like, okay, you're good. Oh no, you fell in the hole. You get to pay 5 times more.
Yeah. So I like to tell clients the whole Part B drug stage system. My analogy is like the first part of a roller coaster ride. So you're in your cart, you're paying towards your deductible, and then you're going into the initial coverage stage, and then at the very top, right before you're supposed to drop, that's the highest amount of that you will pay for your medication. So that's the donut hole, is the very top, and then you'll drop into the catastrophic because then you're paying only 5% for the rest of the year.
When you think about it, like the amount of money, like to actually have to meet 6550 before things get better again, is a lot of money.
It is a lot, and I have clients who their drug lists are very expensive, and I use a coding system to help me recommend plans. And so this coding system shows me like thousands and thousands of dollars being paid towards medication. So.
Yeah. Well.
I
want to say it sucks because that's the donut hole. It sucks you down into the hole. But anyway, okay. Well, anyway, I don't think there's any remedy. That's just the way the system is set up. So just have to deal with it.
Unfortunately.
Yeah.
Yeah. So any other questions before we move on? Okay. So now we're going to discuss the Medicare Supplement Insurance Plans, or Medigap plans. So the benefits of moving to Medicare, original Medicare, and a supplement plan. So you have original Medicare with a supplement plan that gives you the highest level of coverage. So you have Medicare Parts A and B. Part B requires a premium. Supplements are offered by private insurance companies. And the plans are lettered A through N. Benefits vary by each lettered plan. And generally, the more comprehensive the coverage, the higher the premium. So these types of plans are easier to use. You can see any doctor that accepts Medicare assignment. There's lower to no out-of-pocket expense, better coverage, lower cost, and you're eligible first of the month you turn 65. So some facts, generally the best time to sign.
Excuse me, I'm sorry. Is that an advantage?
Yeah. No, these are supplement plans. They're
Um,
Medigap plans.
So they cover Part A, Part B, and supplemental, and prescription.
So with original Medicare, you can enroll in a supplement plan. The supplement plans don't have prescription drug coverage, therefore you have to enroll in a drug plan as well.
But they do have supplemental, like Medicare covers like what, 60 to 80%.
So
You need the supplement.
Correct. So generally, and I think I'm going to get into it in the next couple of slides, but generally Medicare pays 80% and your supplement plan picks up the remaining 20%. So it gives you that 100% coverage.
Oh, okay.
So think of it like a block of Swiss cheese. There's the block of cheese and there's holes in the cheese. The supplement plans cover the holes. That's why they're called Medigap plans. So they cover the gaps.
So the Medicare A and B is a block of Swiss cheese with holes in it. And to fill those holes, you fill them the other 20% with a supplement or an advantage plan.
Yes.
Right. So this medical supplemental is what you're talking about, is the additional supplemental plan. Okay. I got it now. Thank you.
It'll pay the remaining 20%
Mm-hmm.
that original Medicare does not cover.
Yeah. I mean, I think I have Blue Shield as my supplemental on top of Medicare right now. Okay. Thank you.
Great. You're welcome. So generally the best time to sign up is during your 6-month open enrollment period. Some states have additional open enrollment periods. These plans can go with you anywhere in the US, and they're guaranteed to continue as long as you pay your premium on time and have not made any material misrepresentation on your application. So here's a chart showing the different standardized letter Medicare supplement plans that are available to enroll and purchase. So this is where it can get confusing as well, because the different parts of Medicare are lettered, and they just decided to letter the plans as well. So here you see plans A through N, and then the benefits that are included. So did you turn 65 before or after January 1st, 2020? If you turn 65 after January 1st, 2020, that means the Plan F, the richest plan available to purchase, is unavailable for you to enroll. The next best plan would be the Plan G. If you turn 65 before January 1st, 2020, and you kept working, the Plan F is available for you to enroll in. So just to give you an idea of what the monthly premiums are for a Medicare supplement Plan G, the rates are determined by age and location. So the rates do increase each year you turn another year older. Various insurance carriers also have additional discounts available to you when you first enroll. Welcome to Medicare discount, and EFT discount if you set up your premiums through auto pay, and household discounts. So household discounts if you live in a household with someone over the age of 60, I believe, or if you have a spouse that's enrolled in a Medicare supplement plan as well. So the Plan F and the Plan G are very similar to one another, and they are identical in benefits and the coverage. The only difference between the two is the Plan G has a $203 Part B deductible for 2021. So you, Part B again is your outpatient and doctor visits. So you would need to satisfy that $203 Part B deductible in order before the plan starts paying. So when should you sign up? So you have a 7-month window to apply for Medicare when you first turn 65. 3 months before the month you turn 65, the month you turn 65, and 3 months after you turn 65. When you enroll in Parts A and B of Medicare and receive your Medicare ID card, it is recommended 1 to 2 months before your 65th birthday to meet with an agent to discuss your options and to sign up for a plan. So coverage always starts the first of the month. So if your birthday is the 15th or the 27th, your effective date will always be the 1st. If your birthday is on the 1st, then you are eligible for Medicare the month before on the 1st. So how do I sign up? If you are not already receiving benefits from Social Security, you will need to sign up for Part A and Part B. You will not get Medicare automatically. So you can enroll in Part A and Part B of Medicare online on the Social Security website, or you can visit your local Social Security office to complete an application. So if you're leaving an employer plan, you may need to go into the Social Security office to apply, as they may require documentation from your employer. So when can I change my Medicare plan? So you have two opportunities or two enrollment periods every year, one for your Medicare supplement plan and one for your Part D plan. In California, they have the birthday rule, which allows you to switch and enroll in another Medicare supplement plan 60 days following your birthday. You do not have to go through medical underwriting to switch plans. The new plan does not have to be with the same insurance carrier, but it must have benefits that are equal or lesser than your current plan. If you decide to switch supplement plans outside of your birthday enrollment period, full medical underwriting is required. The second open enrollment period is for your drug plan. So the Part D open enrollment period takes place every year between October 15th through December 7th. If you decide to make a change, new coverage will begin January 1st of the following year. So if you decide to enroll in a Medicare Advantage plan, which again is different from the Medicare supplement plan, you will have the opportunity to switch plans during the October 15th through December 7th period. There is also a general open enrollment period that takes place between January 1st and March 31st. So our office has the ability to do online enrollments, which makes applying for your Medicare supplement and prescriptions easy. No paper applications or needing to come into our office to complete applications. So everything can be done online. So Medicare doesn't cover most dental services. So if you're looking for coverage, it is recommended you either remain with an employer plan, take COBRA, or enroll in an individual plan. So when we can travel again, remember, in most situations, Medicare won't pay for healthcare or supplies you get outside of the US. So there is a minimal travel benefit if you enroll in a Medicare supplement plan, but only in emergent situations, and it does not cover evacuation. So our office also handles travel insurance. So the next slide. The premium is determined by your age, the length of trip, and your coverage amount that you select. So we recommend our clients to purchase separate travel insurance if you're traveling abroad. Last but not least, Medicare and the coronavirus. Medicare covers the COVID-19 vaccine at no cost to you. Medicare Part B covers testing for COVID-19, and Part B also covers COVID-19 antibody testing. Well, thank you for having me. This concludes my presentation. And if you have any questions.
I have a question.
Hi, Dennis.
Hi, how expensive is the travel healthcare insurance? Because as we get older, that's on our list to do is travel a lot. So
Correct.
are we talking about a couple $100, or are we talking about thousands of dollars?
No. It's really based on your age and the length of your trip. So I would say between 60 to a couple hundred, depending on the length of your trip.
And only for emergency stuff, not for buying medicines and stuff like this. Like if you get in a car accident or you fall or something like that, correct?
That's all covered, and then doctor visits are also covered under the travel policy as well. So you can get your medications as well.
Okay, so it's very reasonable. So I'm assuming, hopefully you don't have to use it, but it's a good safety net just in case.
It's good to have, correct.
Okay,
And
so
then I'm
that
just gonna put
concludes.
my contact information again, sorry.
Very good. That's what I was going to ask you to do, Lorna, before we conclude the recorded portion of this presentation. So there is everybody's contact information. I encourage everybody to screen share and get a hold of Lorna for more detailed information.